Now, on the vaccine program itself, we made some further important decisions today. We will be bringing further forward the pharmacy program and accelerating that, which was due to be coming in September with the Moderna vaccines and the mRNA vaccine. That will still occur for the mRNA vaccines, but pharmacy has always been an essential part of the Australian healthcare system, and earlier this year we did the pre-registration process and was able to identify some just shy of 4,000 pharmacies found suitable to participate in the rollout. Right now, there are 118 community pharmacies currently vaccinating around the country, particularly in rural and regional areas where they're supplementing the GPs, where there's a shortage of GPs in particular areas. By the end of this month, there'll be 470. So for every pharmacist that's out there doing vaccinations right now, there'll be 3 times as many by the end of this month. Now, we also were able to identify 1,262 suitable pharmacies from regional, rural and remote areas that will be able to come into the program, and a further 2,668 in metropolitan areas. I note that particularly in the metropolitan areas affected by the latest outbreak in Sydney, in Fairfield, Canterbury, Bankstown and Liverpool, 48 pharmacies will commence offering vaccines in these areas by the start of next week. There's also the Chester Hill GP Respiratory Clinic, which has also been set up, and we've been working to establish that with local doctors there over recent weeks to get that in place. And I particularly want to thank Dr. Reefy for working with us and the Commonwealth and State Government on those initiatives. From next Monday, all community pharmacies across the country will be eligible to request participation in administering AstraZeneca vaccinations to the Australian population. We expect to see them commencing their vaccinations in mid-August. There is a process of the training, the certification that you need to go through. Safety is always important for the administration of vaccines, and that's what will be happening. So from next Monday, the Department of Health will be reaching out, and similarly pharmacists reaching in to get that process going, and that follows what I've already said, which is the tripling of pharmacies by the end of this month. Now, I also want to stress that all remaining GPs who would like to participate in the program can also do that from Monday, and that is all about increasing the many points of presence, and this is for AstraZeneca, I should stress. This increase in the pharmacy rollout for now is about AstraZeneca, and it's particularly designed to ensure that we can address those more vulnerable populations over 60. So it's very important in Sydney, as I said before, but we're facing challenges in Victoria where things are a lot more manageable, and also in South Australia. And so far, those signs are encouraging, but there's still further time to play out there. But if you're in Perth, if you're in Tassie, if you're in Darwin, if you're up in North Queensland, in Cairns, or wherever you happen to be, this is important to ensure that you're protected. The Delta variant is very aggressive. The vaccines work against the Delta variant. That is confirmed to us time and again, but it is important wherever you are in the country to please go and see that pharmacist when they're available, or go and see your GP and make sure that you're getting the AstraZeneca vaccines. And similarly, through the state clinics that are providing those AstraZeneca vaccines, and we are of course encouraging them to do that, that you can go and access there. Now, just a couple of final points on payments. Good news from yesterday is that Services Australia are processing more claims than they're receiving. They processed just shy of 70,000 claims yesterday on the disaster payment, and received some just under 65,000. They're making great progress. I want to thank all the people at Services Australia for the work that they're doing, those both on the phones and those working the online systems, which are proving to be very effective and are standing up. In total, $257 million, $238,500 has already gone out the door in New South Wales, in response to some 518,399 claims. This is obviously a big demand on the system, but the system is meeting that demand and people are getting access to those payments, those $600 and those $375 payments. And again, I want to thank Services Australia for the great work they're doing. The call times are coming down. And also, I'd note that from Friday, tomorrow, that's when Victorians can go online. And I encourage them to go online first. You have a CRN number with MyGov. That's the easiest way to do it. That's the fastest way to do it. And encourage you to use the online channels. For those who have particular needs, those in cold communities, things like that, or need to discuss other elements of their support, then the phone number, telephony offer is there for you as well. But please go to the online. Yesterday there were some 170. So far there's been 172,885 calls answered at Services Australia, and yesterday there was around 17,500. So they'll keep getting on with that job. We'll keep getting on our job, and happy to take questions.